A survivor story is meant to inspire us. We learn of their tragedy, self-doubt, and eventual triumph. But what about the story of an individual who has survived by cheating death 3 times? Well, RJ Wyndham is that person. His story is not only motivational, it is inspirational. Through the Patient to Patient podcast, you will be captivated and taken on a real survival adventure, meeting global experts and cancer survivors just like you, where no topic is out of bounds. Now, your host, RJ Wyndham.
Welcome to Season 1, Episode 3 of the Patient to Patient podcast. I'm your host, RJ Wyndham, and for today's adventure, you and I are going to travel to the United States to meet a good friend and physical therapist extraordinaire, Marina Kesler. Well, the clock's ticking, so we better get going. Let's fire up the virtual rocket and head to the United States. Marina Kesler, welcome to the Patient to Patient podcast.
Hello, RJ. How do you do? Thank you for having me. I'm very excited to be here.
Well, it's my pleasure. And I know everyone watching and listening around the globe really appreciates all the guests that we have here at the Patient to Patient podcast. And yours is very interesting, your background. And it's something that pretty much no matter what type of procedure you have, whether it's in most cases a prostatectomy, the first person that you'll see after your surgery is a physical therapist. So why don't you tell us how you got started in physical therapy?
I got started in physical therapy almost 30 years ago. I decided to pursue the career of rehabilitation and recovery to bring positivity physically, emotionally, and psychologically to patients. It became my passion. And I went for it. I graduated from actually several schools. I have several degrees in physical therapy and have been working for a number of years. It will be, in 2 years, it will be 30 years since I'm practicing. And I have been doing pelvic health for about 14 years. And definitely one of my specialties is to work with male patients after prostatectomy.
Oh, okay, fantastic. Now, one of the areas that I get a lot of people emailing me and asking me questions about is that they feel that the care kind of falls down a little bit for pre-surgery. So what advice would you have to men that are listening and watching about some things that they can do even before the surgery to get them prepared?
There are a lot of things they can do. They can actually ask the doctor to go and see a physical therapist preoperatively so they can start learning how to rehabilitate their pelvic floor muscles after the surgery. I also think it's a good idea to start a healthy lifestyle, especially cardiovascular fitness, and possibly change the diet. I would also encourage men to work on the stress management and their emotional being, because this type of operation does change a man's life. This is something that the person definitely should be ready for, and it will help them to get through and pull through the entire rehabilitation process.
What advice would you have them, take to heart about the physical and mental? Because I'm so glad you touched on that. That's one of the themes that we're doing here on Season 1, is to have people understand that it's both physical and mental. And it's such a Herculean task, recovery. A lot of people don't realize it, and it's not explained to them. So why don't you go ahead and let everyone know what you would, suggest for them, since you touched on that subject, and seeing people coming in from surgery. What would you recommend to them?
Definitely. This is a very important point that you bring, RJ. I would definitely recommend that they become patient, because in the society of today where everything is instant, the body healing process is something that does take time. It takes minimum to 6 to 8 weeks to start seeing primary healing. The recovery after the prostate surgery may take up to a year. And if men are patient with themselves and with the progress, they actually progress much faster. It's probably a misnomer, you hurry up and wait. But in the case of recovery, where the body is going to take its own time, also depending on possible comorbidities that a person may have, possible lifestyle, environmental living situation, mental state, family and social support, all these things are going to vary. So patience and positive attitude, I would say, would get you a very, very long way. And I don't mean to just say those words lightly. I live it and practice it every single day. And
okay.
Yes.
No, fantastic. Also, one of the things you touched on, too, if we could just circle back for a moment, you mentioned diet. Do you have any suggestions? I realize that you're not a dietitian, but do you have any recommendations for men that are going into surgery or even post-surgery as to changing their diet and the effect that it has on them?
Yes, I can definitely give some suggestions. First of all, the diet should contain things that are high in lycopene. Lycopene is a certain, it's not really an enzyme, but it's a certain ingredient that helps fight cancer cells. And those ingredients are normally found in tomatoes and also in bell peppers. Also, on the list of things that definitely should be consumed are pumpkin seeds, papaya, dark greens. Things that should not be consumed is alcohol, especially white wine and hard liquor. Definitely having active lifestyle, doing aerobic activities where the pelvis is actually moving. It can be a stationary bike, but it can also be hiking, it can be running, it can be jogging. Anything that can help to stabilize the weight or to improve the weight loss, that would be absolutely wonderful. Another recommendation would be to empty the bladder completely. We all know that the bladder never empties completely, 100%. Right. But at the same time, when a person waits for hours and hours to urinate to, build their endurance, this is really not the time to work on it. The time is to actually empty the bladder completely, and by doing that, lesser the pressure on the prostate that has already been compromised.
Okay, these are excellent points. Now, when the urology department makes a referral for patients to come and take part in your physical therapy rehabilitation program, does your approach differ between younger men and older men? And if so, how?
My approach is to help every patient that comes through the door. Every patient has their own differences. If it's a younger person, they can still be very deconditioned and debilitated. If it's an older person, they can be fit. So it really depends on case-to-case basis. And I pretty much within a few minutes can tell, and definitely based on the physical examination, I can tell which exercise program I will start the person with. Some people I start just on the exercises themselves. Some people I will start possibly on the electrical stimulator because their muscles are just too weak, or they may be really incontinent. So it depends. It depends on what impairments the person has, and I look at it this way.
Mm-hmm.
I don't feel that the age is the most determining factor. It is, but in my practice, I have seen all variations.
Right, right. Well, let me give you an example. I'm going to make something up. What if you had a fit individual that walked every day, was 50 years old, non-smoker, probably social drinker, that just went through a prostatectomy? What would you implement for someone, based on the, characteristics of the individual that I just described?
It would depend also on the results of his pelvic floor muscle testing and also on the testing of his abdominal muscles. So I would implement the exercise program, home exercise program right away, immediately.
So that's something that you would determine in like an initial consultation? Is that how it would work?
Yes, yeah, that's what you do.
Okay, so walk everyone through. Basically, in this example, I've just had a prostatectomy, mm-hmm. and the surgeon implemented a nerve-sparing technique, staying, in character. I'm 50 years old. I walk. I don't smoke. I'm pretty athletic. What would you have me do as far as testing to see where I would be in order to implement your program?
Excellent question. I would first find out when your surgery has been done, because usually surgeons have their own protocol, but the surgeon that I work with actually recommends that no internal rectal exam should be done prior than 6 weeks post-operatively. So that is the most determining factor for the
right.
intrarectal exam. If the person comes in 6 or less weeks post-operatively, then the next best thing to do to evaluate his pelvic floor muscle strength is through observation. And that is usually done both in sitting and in laying down, when me, as a physical therapist, I ask the person to stop the urine and the gas, and I observe how their penis and the testicles and the anus is able to lift up or contract, and how well he's able to understand the command, how well he's able to do it. And also if he's holding his breath, if he's having some other substitutions coming from different body parts, most often happening, the abdominal muscles tightening too much, or the gluteal muscles, the buttock muscles are tightening too much. So things like that. And then, yes.
Oh, no, I was just going to say, what are the biggest challenges that you face? Because there's only so many hours in the day. I know that you work at a major facility in a huge city here in North America. But what would be the challenges in implementing a program, and what would you like to see for everyone that's watching and listening at home that may not have access to care like this? What would be the best thing that you could impart to them that they could implement right away?
For me specifically, where I work, the challenges are the access. In other words, the ability to see me frequently is a challenge because of the amount of patients that I have to see. And the other challenge, I would emphasize two more, is the patient's compliance with the exercise program, their understanding of the importance of their rehabilitation, and their mental attitude towards the entire rehabilitation and prognostic process.
Right. Right. I would agree with that. And you've said you've been doing this for 30 years, and I know the level of your expertise. But if you were to go back in time, is there anything that you would change in the approach that I guess what North America has towards recovery, specifically with pills, pumps, and pelvic floors? Is there anything that you would like to see maybe changed or maybe implemented sooner or later?
I think the patient education process about the prevention of the malignancy should be starting much earlier. I think we're waiting too long until the patient is in their 40s, 50s. I think this education needs to be started when men are in their teens, because it's the lifestyle and habits and just the way they use the body and what they're putting in their body really makes a big difference. We all know the impact of environmental factors on the rates of cancer today. But at the same time, I do have some success stories where patients have been diagnosed with the prostate cancer, and right now they're on watchful waiting because they actually took my advice to heart and they started working on their weight. They started working on changing the diet. They started working on exercise. I mean, they literally followed the recommendations of a health professional, of a holistic health professional like me.
Mm-hmm.
And it is paying off. And I would like to see that done on a much bigger scale, much bigger scale.
Now, let me ask you a question. Keeping in that same vein, I'm an advocate for screening across the world. I've talked to people in various countries from different continents, and we all come back to the same thing. We all come back to screening men earlier. So it used to be 65, then 60, then possibly 55. What do you think of men being tested, basically their PSA levels or through a blood test that's, say, 45 years old?
I think that's still too late. You have to start early.
Still too late. Okay. Yeah. What would you say? Maybe in your 30s, maybe
yes.
40?
30 to 35. Yes.
Okay. Very good. Because we see the studies, and it just breaks my heart when I see men 35, 36 years old diagnosed with prostate cancer. So my thought process is that, as I said, it's only a blood test. And I know that some GPs are reluctant in different continents. It varies according to where you are and where you're listening and watching this program today. But if at all possible, the earlier, the better. I do agree with that. And then just to build off of the pills, pumps, and pelvic floors exercises, where do you find the pills and even something like a trimix injection? Do you find that to be something that would be positive, or do you find that maybe a trimix injection would be a negative?
I think the patient is really the best judge, because the patient is the one who injects the trimix into the penis and looks at the reaction. But as a physical therapist that is working with men with erectile dysfunction, the power of the pelvic floor exercises and the power of cardiovascular fitness, along with use of the pump, along with self-stimulation, along with the social support, with the spousal support or partner support, is immensely important and immensely effective.
Right. Maybe what we can do for all of those that are listening and watching that we just lost completely. with trimix injections. Maybe you can explain to everyone out there what trimix injections are and what and how rather they would be prescribed by a urologist.
I think those are the injections into the penis to actually achieve and sustain the erection. And they're prescribed by the urologist when a patient reports that he still has erectile dysfunction, definitely based on the surgical necessity to remove the lymph nodes that contain the nerve endings that are leading to the penis to actually make the erection happen. So it depends on how much nerve sparing actually happens in the surgery.
Right.
So I have seen different degrees of erectile dysfunction happening, but there is one thing that is extremely important. I'm going back to my statement that I said earlier. If the men are patient and if they have positive attitude and if they're calm about it, and I can only imagine, I know how important the erection is and the whole masculinity that comes with it. But at the same time, those tissues have to go through their own process. And if you really consider the swelling, the pain, the decrease in the blood flow that was there in the first place, that who knows, possibly has caused the cancer to start. Mm-hmm. If that decrease of the blood flow keeps happening, how can we expect the erection to happen? It's not a miracle. You got to work on it. Right. It's all about bringing the blood flow back into the tissues. And that's why you really need to change your lifestyle and you really need to improve your fitness level, because that's what will bring the blood to the area. Mm-hmm. And actually will improve. Yeah. And then will improve your mood too, because the endorphins are going to kick in when you're doing cardiovascular work too.
And see, for everyone, again, that's listening and watching at home, this is such a huge issue with men. So you have the psychological aspect of finding out that you have cancer. You have the physical and I guess emotional weight, if you will, of yes. the surgery. And then you also, in many cases, statistics show that 80% of men that go through some type of procedure have a partner. So you have that stress of maintaining a relationship with your partner. And this is why Marina and I are talking about this subject, because it's so important. And it's one that in many cases, men find that they can't even talk to their partner about it. So that's why it's important that we address these issues, that we talk to a professional like Marina, who's working every day in the trenches and understands, the importance and the patience that is required. And so Marina, and you touched on a few points that I just wanted to clarify. Can you explain to everyone what nerve sparing surgery is and how the procedure works? Obviously you're not a urologist, but you understand completely how this procedure affects men.
Well, I can only explain from what I know about.
Of course.
About the operations. I actually have observed a few prostatectomies. It is basically when the malignancy, when cancer penetrates not only the prostate gland, but the lymph nodes that are located nearby that actually work in the process of detoxifying the blood and cleaning it, between the arterial and the venous supply. that's when the surgeon decides to excise those lymph nodes so that the cancer does not keep pervading those vulnerable tissues. So it's a very difficult choice for the surgeon to make, is to first of all inspect the lymph nodes, to also know the Gleason scale of the existing tumor, but also to inspect the nodes and see, how do they look? Do they look healthy? Sometimes it's probably hard to tell. I'm not there in the operating room.
Of course.
And they probably take the biopsy of the nodes that they excise. But I think the surgeon guesstimates, maybe he removes this amount, he will actually save a man's life. And that also determines how much of the nerve tissue that gets removed along with the lymph nodes gets spared or gets removed. And the nerve tissue, we're talking about the pudendal nerve and the dorsal nerve of the penis. So those are the nerves that we're actually talking about. How much of the nerve connection and the endings will be left during the prostatectomy and how much of it will be removed, because the risk of leaving the lymph nodes along with the prostate is higher for the malignancy to reoccur or to get more severe versus removing those nerves and therefore saving a man's life.
Right, exactly. And I know it's complicated, and I know we're taking a deep dive here, but it's important that everyone understand the process and what the recovery are. I guess, there's no real timeline, but what I guess the word that I'm searching for is the best way to reach the goal and take the step forward in recovery. So why don't you help everyone in explaining to them after the surgery, after the prostatectomy, you assess that where they are in their rehabilitation. How long do you end up seeing patients? You told us on the onset that it's so hard to get an appointment with you, and I completely understand that. But how long do you end up seeing a patient for on average?
I can see patients from 3 to 12 months.
Okay.
That is really not a big issue. I actually teach my own video group class through the organization where I work with. The class is specifically designed for people with incontinence. And it's a co-ed class. Both women who have their incontinence issues join the class, and also men after post-operative procedures such as prostatectomy may join the class. So the class meets weekly. It's an hour-long session of exercises, strengthening exercises, pelvic floor muscle exercises, breathing exercises, abdominal workout. And because it meets weekly, it has a very good continuity of care. And I'm able to see people, and I'm actually able to see people progress. And then every 2 to 3 months, we do individual sessions where we meet back in the office in person. I prefer that. I can retest the strength. I can retest the endurance, and we can talk about the issues that arise that we definitely will not talk during the group class. So I'm very fortunate where I work, even though it's challenging to see patients often, but at the same time, I'm able to see the patients for a long period of time. So I'm actually able to see their progress 6 months post-op, 12 months post-op, 18 months post-op, and really see the big picture of how their recovery is going in general. And I can also give suggestions along the way. I just wanted to give a couple more points. As far as the education goes, I really truly believe that the patient's partners, spouses, family members who are involved in the process really need to be educated along with the patients, and because they are the ones that are carrying the burden of taking care of the loved one, of really empathizing through them, with them, and going through the process sort of vicariously. And they a lot of time need a lot of support as well. So.
No, let me ask you a question. I agree 100% with the importance of the partner, because of the fact that the partner is often overlooked, and having them be involved from the beginning really is essential. Now, I just wanted to touch on your course, your class that you said you do on Mondays, and it's for both men and women. Now, if someone was watching or listening to this, how would they be able to, or would they be able to participate in your weekly class, or do they have to be part of the medical group that you're associated with?
I wish I could open the class to the entire world, but you do have to be a part of the group. And one of my goals is to actually have either live streaming classes or pre-recorded classes that I can do for the world community of the patients. And I know it will be very, very helpful.
Well, in all transparency, Marina and I are actually trying to work on that as we speak. What we're trying to do is, it doesn't matter what continent that you live in, if you can access YouTube, not just the audio podcast, but it would have to be the video podcast. We're actually working on something right now that would take the course that Marina does for the medical group and have it available for anyone with an internet connection, and that has the ability to come to the patient-to-patient YouTube channel. So we're going to keep you posted on that. We're not quite there yet, but it's definitely in the works.
We're moving in the right direction.
We're moving in the right direction. And then one of the last topics that I wanted to discuss, and you touched on it briefly, was incontinence. And this is embarrassing for men. But if you could explain to everyone that's out there, what happens to a man when he's had a prostatectomy, and maybe how you address the issue of incontinence.
A prostate for a man works as an internal urethral sphincter that actually supports the urethra that is located right under the bladder. So if we can imagine, if this is the bladder, then where my hands would meet, where the bladder neck is, this is where the prostate sits. And the prostate, in the way, hugs the urethra that just exits, I should say, from the bladder. So the prostate offers at least 90% of continence for a man, because it's there, it supports the bladder, it works as a sphincter. So the pelvic floor muscles, which are the skeletal muscles that can be controlled with our will, they really are not that involved in the process of urination for a man. Until that one special day when the prostatectomy gets done and the prostate gets removed. So the bladder still stays, the urethra is still there, but that sort of supportive mechanism that the prostate offers is not there anymore. And the only mechanism that can actually prevent the leaking from happening is located a little bit below the prostate. That's the location of the pelvic floor muscles. They're called pelvic floor muscles because they're literally located at the very bottom of the pelvis. right next to the anus. They're located under the bladder, under the rectum. They're kind of a final muscular frontier. And so the man has an opportunity to become continent by starting to activate the pelvic floor muscles. And these muscles have to be activated specifically. In other words, if you're going to tighten your abdominal musculature or your buttock musculature, it will help, but it's not specific enough because those muscles are not involved in helping to maintain someone's continence. But the pelvic floor muscles, yes, are involved directly.
Exactly. And then to kind of give it everyday practical application, what Marina is instructing is very, very good advice. But for men, after a prostatectomy, we leak. There's no two ways around it, and a lot of men will have to wear a shield in their underwear to protect from the leaking. And this is embarrassing, and a lot of people don't talk about it. But as Marina just gave us the advice on how to strengthen this muscle in order to make us go from incontinent to continent. And I'm sure there's everyone out there that has some sort of embarrassing moment if you've gone through this type of surgery. So we're here to say it's fine, it's okay, it's going to get better. And so, Marina, there's people out there that perhaps want to get into this field, the field of physical therapy, but perhaps working with male patients in helping men recover from a prostatectomy or some type of surgery that involves prostate cancer. What would your advice be to someone that's looking to get started today as a physical therapist?
You're going to get into a very challenging yet incredibly rewarding career. I could say you're going to be saving people's lives in a big way because you're going to give them hope. You're going to give them inspiration, a second chance, a third chance, a chance. You're going to be there like a guide, like a coach, inspiring, instilling, and really going along the way with each patient, walking along with the process that they're going through. And it may not be for everybody, but when you commit to the profession, it will give you nothing but an incredible reward.
I couldn't have said it better. I actually had someone describe it this way. They said, I'm going to give you an athletic analogy that you tore your knee playing tennis. So after the surgery, your knee basically is non-existent. It has to be rebuilt like any type of muscle. It has to go through rehabilitation. It has to go into strengthening exercise. You can't just go and start running again. The same thing with a prostatectomy. Now, I know that's a simple analogy, but the strength is still there in the ability to strengthen the knee and work on any type of muscle or any type of injury. And again, I'm not explaining this correctly, but I think you get the idea. So, Marina, I want to thank you so much for joining us today. I know we took a deep dive into some pretty, tough subject, and I appreciate that. And hopefully everyone listening and watching enjoyed that. And keep an eye out for more of Marina Kesler in her program. So, Marina, thank you again for joining us.
Well, that's going to do it for us today. Be sure and check out the free resource section at rjwyndham.com. And remember, a journey is something you do on your own, but an adventure is done with loved ones and friends. Until next time, I'm your host, RJ Wyndham.
Thanks for joining the Patient to Patient podcast. If you enjoyed this episode, make sure to like and subscribe for free. If you know of someone that could benefit from today's show, make sure to share this episode with them.